Hello, welcome everyone to the UNFCU Foundation and panel discussion of the power of partnerships and how, more specifically, healthcare programs accelerate women's economic empowerment. My name is Pamela Agnon and I'm chairperson of the UNFCU Foundation. As many of you know, the UNFCU Foundation is a nonprofit organization. We're dedicated to sustaining the path out of poverty for women and youth through healthcare and education. I want to thank event organizers, UN Women, and each of you for joining us today. The topic of healthcare and its access has taken on even greater relevance during these challenging times. The global pandemic continues to impact women in vulnerable communities the hardest. Yet barriers to healthcare solutions are coming down through determination, innovation, and resiliency. Today's discussion is sure to be highly inspirational and interactive. You'll gain insight on proven approaches that have positively transformed the lives of women and youth. Joining us today are three UNFCU Foundation partners: the United Nations Population Fund, also known as UNFPA, UNICEF, and our Long Island City neighbor, the Floating Hospital. Our partner organizations have pivoted, refreshed, and retooled to serve women whose resiliency is simply incredible. Their work to restore dignity to women and ensure their full economic participation underscores the effective power of partnerships. It's in this spirit that I'd like to introduce our first panelist, Maria Rosa Keita, the Chief of Strategic Partnerships Branch at United Nations Population Fund. Maria Rosa serves as lead communicator and builder of support for UNFPA-led global campaign to end fistula. The campaign is comprised of over 100 agencies dedicated to all aspects of obstetric fistula globally. Maria Rosa has more than 20 years of professional experience in the field of sustainability. Prior to her role at UNFPA, she was head of corporate social responsibility at the Benetton Group. She also served as president and CEO of Benetton's Unhate Foundation. Additionally, Maria Rosa led a movement within the European Union known as the Global March Against Child Labor. She currently represents UNFPA as a member of the Prada Group Diversity and Inclusion Advisory Council. Welcome to Maria Rosa. I'd also like to introduce our next panelist, Fatima Gohar. Fatima is the maternal and newborn health specialist for UNICEF's Eastern and Southern Africa Regional Office based in Nairobi, Kenya. She's dedicated to bringing hope and life-saving care to lives shattered by crisis. Since 2017, Fatima has provided strategic and technical support to 21 countries in the region for adaptation, implementation, and scaling up of high-impact maternal and newborn interventions. Thank you for joining us today, Fatima. Our final panelist is Dr. Michael Chang, a staff clinical psychiatrist at the Floating Hospital based in New York City. He joined the organization last year, having completed his medical residency at the University of Hawaii Psychiatric Residency Program. Dr. Chang served patients in Hawaii for 21 years. He worked at Hawaii State Hospital, Schofield Army Barracks, Adventist Hospital, and as an Assertive Community Treatment, or ACT, team medical director. Dr. Chang was also an assistant professor at the University of Hawaii Medical School, and his work with military patients led him to specialize in trauma treatment. Welcome, Dr. Chang. To help our experts share their stories, I'm pleased to introduce Ima Gordon-Reed, the Executive Director of the UNFCU Foundation. I'm going to hand it over to you now, Ima. Thank you.
Thank you, Pam. Hello, everyone. As Pam mentioned, my name is Ima Gordon-Reed, and I serve as the Executive Director of the UNFCU Foundation. I'm really excited to moderate our panel of amazing partners today. Welcome to all of you as audience members and to our panelists again. We're so grateful that all of you joined us today. Last year, like all of you, were really dismayed at the impacts of the global pandemic and concerned about the devastating, really crisis that happened all over the world and the impact that it had on people's lives. However, as Pam mentioned, despite the challenges, we were really truly inspired by the work of our grant partners and continuing to work with women and girls around the world. In forming this panel, we wanted to talk about the balance between the urgency of the moment that we find ourselves in and with the demands of those of us who have been funding and supporting and those on the panel who have been really in the front lines of supporting healthcare over the long-term basis. So really talking about the balance of that. Given the past year, it is really no secret that the importance of healthcare, and particularly access to quality healthcare, has increased as a critical human right. And as long-term funders of healthcare, we know, as do all of you, that access to quality healthcare can transform the lives of women and girls. Its access, along with necessary opportunities for education and economic opportunities, livelihood, really do create important and sustainable paths to tackling poverty. And I'm pleased, that we were amongst the other organizations to be able to support the COVID-19 Solidarity Fund that was hosted by the World Health Organization last year. Really important needs were filled through that fund. But equally important are the solutions for the long term. So for today's discussion, we wanted to bring together some of the UNFCU partners who have consistently been on the front lines of the battle to provide women and girls quality health care, both physical as well as mental health supports. We'll talk about that today. And we really understand that in every crisis, while they affect vulnerable populations most acutely, we know that it is also true that when economic and education and safety and violence factors are in play, that it creates higher stakes for the most vulnerable populations, namely women and girls. But what does that actually mean for us in terms of the rebuilding that has to happen and for the needed focus ahead? This year's theme of the 65th session of the Commission on the Status of Women, CSW, that we are part of today, is one of expansion, women's full and effective participation and decision-making in public life, as well as the elimination of violence for achieving gender equality and the empowerment of all women and girls. But without a doubt, without access to quality healthcare, it is a full uphill battle to achieve effective participation and empowerment for women and girls anywhere in the world. So with that, we're thrilled to have our partners from UNFPA, the Floating Hospital, and UNICEF here today for this important discussion. As a foundation, the UNFCU Foundation is really focused on the urgency of this moment and how we can both support long-term and short-term solutions to this critical need. And we're really thrilled that you as audience members chose to join us today for this important dialogue. To begin our discussion, I'll ask our panelists to briefly introduce their organizations, describing briefly their organization's impact on the ground. And then following our discussion, we were excited for all of your questions. We will save those for once the panel discussion concludes. We invite you to use the Q&A feature in the webinar at the bottom of your screen for your questions. We'll try our best to get to as many of them as we possibly can. So we'll begin with Maria Rosa Cotillo of UNFPA, followed by Fatima Gohar of UNICEF, and then by Dr. Michael Chang of the Floating Hospital. Maria Rosa, will turn to you and ask you to introduce your organization. Thank you.
Thank you very much, Hima, and thank you very much, Pamela. It's a pleasure to be here today. Our one is a story of long-term loyal partnership with a strong impact on the ground. The United Nations Population Fund is the leading UN agency on sexual and reproductive health and rights. We are present in almost 155 countries with programs, with actions that are around what we call our 3 transformative results: zero unmet need of family planning, zero preventable maternal deaths, zero harmful practices, starting with eliminating gender-based violence, eliminating child marriage, and of course, all the other harmful practices that affect women and girls. We will hear later some figures that have been increasing quite strongly, particularly during the COVID-19 crisis. Partnership is, of course, for us, one of the key accelerators for our 3 transformative results, and alliances with all types of stakeholders that want to buy in our agenda are one of our key purposes now and for the next, I would say, 10 years, which are really crucial to achieve the Sustainable Development Goals. Thank you very much.
Great, thank you so much. I believe we have a video for UNFPA.
Yes, the video is actually around our partnership with UNFCU in Nigeria, and it's around a partnership on obstetric fistula. You will see it's a video around our impact on the social and economic empowerment of women, a very strong impact on the ground to make sure that there's no discrimination and the women are empowered to go back to life after the situation created by fistula for them. So we'll probably move forward for the video. Thank you.
My name is Khadija Yakubu. I was married at the age of 14. I got fistula at the age of 15. Very bad experience. I was divorced by my husband. The people. I decided to look myself at. I hated myself and felt like committed suicide. We found out that fistula can be treated, but my parents no money to pay for the surgery. I heard on the radio that there will be a free fistula repair surgery. I got the surgery done. Dry. Now I am happy. I learned sewing and was given sewing machine. I am now supporting my family. Learning how to educate people on fistula prevention care. Educating women on the importance of ANC and hospital delivery.
My name is Aisha Hussein. Yes, of course. She had a long labor in her husband's house, and I was not told. It was after 3 days that one of her neighbors informed me about it. I told my relatives about the situation. We went together, found her unconscious, and then took her to the hospital. We were then told that she has to undergo cesarean section. Unfortunately, the child was dead at birth. She remained unconscious, and I had a bad feeling she might not live. But by God's grace, with the help of these foundations, she has recovered from VBF after all that she has been through. Now, Khadija has successfully graduated from secondary school.
UNFPA, thank you UNFCU, thank you Fistula Foundation.
Thank you. Thank you, Maria Rosa and the UNFPA team. That was quite powerful. We appreciate that. So now we'll hear from Fatima Gohar of UNICEF. We appreciate you, Fatima. Thank you for joining us today. Would you introduce your organization for us?
Thank you so much. As you said, from UNICEF, and UNICEF was founded in 1996 after to protect and help children after World War II, and we are still doing the task. And we work more than 190 countries and territories. Today, I'm representing my regional office, actually. I work for UNICEF Regional Office for Eastern and Southern Africa, and we have 21 countries in the region with different typologies, countries with upper middle income status, countries with fragile context, and countries with lower middle income status. And our regional office is basically, it's a technical hub which provides technical and policy guidance and oversight to our country offices. One thing which I love, one of the reason why I love working with UNICEF is our multi-sectoral approach. We take a holistic approach when we say that we are here to protect and support and help children. And I'll be, to give you just a glance of it, what do we do? Not just regional office, but globally. Let's have a look at this video, and I would request Saeed if you could play the video. It would just, just to give you a highlight. Thank you.
Thank you so much. Thank you so much, Fatima, and to our partners at UNICEF. We really appreciate it, and we're looking forward to hearing more about the work that you're doing, the critically important work that you're doing.
Yeah, thank you. And I also appreciate foundation support as well. Thank you.
Great, great. And so our final panelist that we'd like to introduce is Dr. Michael Chang. Michael, welcome, and we'd love to hear more about the floating hospital.
Thank you, Ima. The floating hospital was started in the 1800s. It started as a ship for a respite for folks with TB, just to kind of get away from the city and get some fresh air. Through the years, it developed into a medical clinic for the underserved, focus on the underserved population. It actually remained boat-based until 9/11, at which point it was hard to get dock space. So at that point, it became land-based. And what I wanted to do was just to maybe go through a patient case presentation to just give you a sense of what we do, walk through it. And so I'll just go ahead and describe, I'll call her Bernice, 47-year-old African-American female. She started at our clinic in 2015. She went through a lot of really awful stuff. She was severely physically abused by her mother. until foster care took her away at age 11. She was sexually abused by her brother for a number of years at a very young age. She had suicide attempts at age 12, age 20. Interestingly enough, she did not have any outpatient behavioral health follow-up in her life, which is not unusual in a way. Because of the trauma, you are in, that constant, fight or flight mode, and it's really hard to trust people or to engage with people. So she started out receiving medical services. About a year after, in 2016, her brother died, and this kind of tipped her over the edge, and she was overwhelmed. She was, at our clinic for a medical appointment, but she was clearly distraught. And at that point, we had a system in place where someone who needs behavioral health services is seen right then and there, which I think is really key, because people can easily fall through the cracks. If she had been given an appointment at that time, who knows, if she would have wanted to meet with somebody and discuss these things. She did meet with Dr. Martinez, that's our clinical director. And so Dr. Martinez was able to strike up a rapport with her, and they worked very closely together. I think they've been meeting pretty much weekly since then. So she got enrolled in our behavioral health services. She started on medication. She still went through awful spells of depression and anxiety, but she had a lot going for her. She was passionate about being a healthcare worker. She took care of the elderly. She would have victories during this time, like buying her first car. She would have more awful things happen, like her son going to jail. Her mood would go up and down. I came on board at the floating hospital in March of 2020, around the start of the pandemic. And that's when I became her prescriber. And so we continued working with the medications. As the pandemic hit, of course, we know this just added to everyone's mental health burden, and it affected her in various ways, including losing her job where she worked with the developmentally disabled, which meant a lot with her. It increased stress on her relationships. She got into a big fight with her daughter. Her daughter's boyfriend was being abusive towards her grandchildren. So ACS, that's our Child Protective Services in New York City, had to get involved, and she had to take custody of the grandchildren. Through this time, when I first met her, it was really interesting. I said, how were you like before you started coming to the floating hospital? And she said, I was a ticking time bomb. So I think she had already recognized, how much progress she had made during that time. But with the pandemic and all this increased stress, financial, occupational, relationship-wise, she fell into another deep depression. And it was really bad. I remember having sessions with her, where she'd have the video session just lying in her bed, with her phone in her hand and just barely engaging. She didn't want to be there. She didn't want to talk. It made me almost wonder, why she even bothered showing up. But she stuck through it. She kept her appointments with me and Dr. Martinez. We continued to tweak the medications, work on therapy, activate her faith and her beliefs in her recovery. And she pulled out of the depression, and she got her job back. She's loving life with the grandkids. I noticed that her appearance, she's paid a lot more attention to her appearance in terms of just doing her makeup and her hair, and she had her teeth done, and it was just really nice to see the recovery. And what I was thinking about was, why did she keep engaging, even though when she clearly didn't want to? And I think it was that relationship that she had built up with the floating hospital, Dr. Martinez, through the years, the trust. And also, I think the floating hospital also has expectations of their clients to engage in their recovery. And that's made clear as well. Because I've only been there a year, so I've been in a lot of facilities with what we would say difficult to treat populations, the criminally insane, combat soldiers, acute psychiatric ward. And when I started at the floating hospital, I understood, okay, this would be a challenging population. I was even a little cynical about it. I was thinking, yeah, I would probably spin my wheels a little bit over there. But there's a very high level of effectiveness from the floating hospital, which I think, there are a lot of factors. There's great leadership. There's really good caring clinicians and therapists. And also this kind of, you got to kind of be on that fine line between the empathy and the caring and expecting engagement in their recovery. So I think they walk that line well over there. So.
Thank you so much, Michael. We really appreciate that powerful, powerful story. It just brings to life how critical the services are that are provided by the floating hospital to folks like Bernice and so many others. We really appreciate that. Appreciate you bringing us that information. So I'd like to, with that, now ask all of our panelists to rejoin us on camera. Thank you so much for introducing us to your organizations. The amount of powerful work that you do is clearly evident, and we're wanting to hear more about that work in our discussion ahead. So thank you for that. Maria Rosa, I'll start with you. And so as per the statistics of our partners at UN Women, we really saw obviously tragic numbers, not just from UN Women, but in terms of others that reported on the impact of COVID-19 last year, all kinds of numbers indicating the deaths around the world. But we did notice that there, in terms of a gender breakdown amongst death, that really men were dying at a higher rate as a result of COVID-19. However, the health of women generally was more adversely impacted through the reallocation of resources and priorities, including sexual and reproductive health services. So we understand the devastating impact that can have. And so wanted to talk a little bit more about these sort of byproducts, if you will, of the pandemic. UNFPA sort of estimates that COVID-19 could potentially result in an additional 13 million child marriages that could take place that otherwise would not have in the next sort of 10 years. And we know that at the beginning of the pandemic last year, it was estimated that the disruption in family planning services would have really a devastating impact, right, on women and girls' lives around the world, but particularly in low and middle income countries around the world, and that inability to access modern contraceptives. So we're just wondering if you can talk to us a little bit about sort of how UNFPA has tackled this. How did the pandemic affect the global agenda of your organization that has critical services, and how the UNFPA has adapted to this new environment?
Yes. Thank you very much, Hima. And as you said, I think, 2020, of course, has been a year like no other. A one-century, a global health crisis that basically puts something really clear on the spot and in front of the eyes of everybody. It has exacerbated so strongly inequalities that have had a disproportionate effect on women and girls. And this overall risks to turn back the clock on women's empowerment and women's rights. And so this is something we don't have to forget, you see, because as usual, we tend sometimes to just forget, and when the lights are not on the spot continuously, we tend to forget this. But this is a catastrophe. And this is a catastrophe because it's a situation that affects women and girls so strongly. They face a pandemic, but they face a pandemic, we would say, as you said, from the data, of violence and discrimination. This is also something that our Secretary General has strongly made clear throughout all the years, and is strongly making clear also simply what's happening. 1 in 3 women experience physical or sexual violence in their lifetime. 1 in 5 girls is married before the age of 18, and hundreds of millions of women and adolescent girls that want to avoid pregnancy yet lack access to reliable modern methods of family planning. This is something we cannot simply watch, and this is something, again, that is turning back the clock. So what have we done? I think we worked really very thoroughly and immediately with governments and with our partners. I think one of the key lessons learned, and we will go back to that when we talk about partnerships, is the importance of building strong ecosystems. Strong ecosystems of partners that, particularly in situations where health systems are disrupted, need to come together. So this has allowed us to act in a sort of very comparatively quick way, and starting particularly with the countries in the regions where we act in high humanitarian crisis. So that's where we started from immediately. And I think, if my figures are not mistaken, but I think we reached out to around 50 million women. And there is something that actually is very measurable for us as one of our, as you call them, a byproduct, or something that really gives a sense. But like almost 7,500,000 dignity kits that we were able to deliver in a very short time, and particularly in a humanitarian context. And when we talk about dignity kits, these are kits that, for example, help a woman to address its menstrual needs. They help a woman to deliver in a safe situation. So in a situation of emergency, in a situation of disruption, like the one caused by the pandemic, this was something that became life-saving more than ever. So I think we can say we've been very impactful, but please, Ima, allow me to say that we're very, very concerned, because we see this attention, yes, still remaining, but a lot needs to be done. And a lot of those ecosystems need to continue working.
Yeah, thank you, Maria-Rosa. I mean, you really have explained to us the urgency of reaching as many women and girls as we can, while we recognize the challenges that we have ahead. We appreciate that. Fatima, we'd like to turn to you next. It was really wonderfully exciting to read more about the delivery of over 1 million vaccines recently in Kenya at the beginning of this month. But we also understand that UNICEF continues to be needed to provide support and to mitigate the ongoing impacts, as we were just talking about with Maria-Rosa, of COVID-19 in the particular region, and of course, the disproportionate impact that it's having on women and girls. Can you talk to us a little bit about that work and what's happening in that region specifically, and supports to women specifically?
Thank you so much. It's good that my colleague Mary, she talked about some of the implications, the dire implications on women and children globally. We saw all of them in the region as well. When COVID hit us, our biggest worry was, okay, one is to respond to COVID, but then the other was, we knew that from the learning from Ebola, that people might not die. You know, there might not be a lot of mortality because of COVID, but many children and women will suffer because of the disruption of essential health services. And and here, I think one of the, as we are calling it as a crisis. It was a crisis, but it was also an opportunity to many of us. It brought all of us together. So things which we did in the region, not as just UNICEF, but also as a collective team of UN sister agencies, but other partners also on ground, key stakeholders. We had this sub-regional case management group, which comprised of we had subgroups of this case management group, and there were several groups. One was on infection prevention practices, then we had group on mental health and psychosocial support. We had groups on the continuity of health services. Under continuity of health services, where I was also part of that group, we quickly put together a guidance on how to continue services for SRM and CAH, sexual, reproductive, maternal and newborn health services and child health services. And we help countries to adopt those guidelines. And it was a joint effort by UNFPA, WHO, UNICEF. And then also we conducted webinars. We tried to reach to the lowest level of health facility, the provider. And also at the same time, we also embarked on the monitoring, because we needed to know what's really happening. And so far we have conducted 2 surveys, and it's a joint UN survey where UNAIDS and WHO, UNFPA, UNICEF are part of it. And we have seen that there is increase in gender-based violence. There is increase in stockouts of core commodities for reproductive health. And we have also seen increase in adolescent pregnancy. So, and then also reduction in some of these services, antenatal care utilization and everything. So we saw the implication of it. Many women and children were not dying because of COVID, but they were suffering because of all the mitigatory measures which countries took, lockdown and all the implication in the supply chain. All those disruption ended up giving troubles and barriers to common women and children in countries. And that's where UNICEF, and with the support of all our partners in all countries, so we had efforts at regional level, but also at country office level. We were working together. I should say everyone was working together to ensure that we give a proper response to the COVID patients, to prevent COVID further spread, but at the same time to ensure that we have a continuity of essential health services, basically sexual, reproductive, maternal and newborn health services and child health services. So those are the things which we did together. And also I would say, in UNICEF, as I earlier mentioned, that we are a multi-sectoral organization. So these are the things I'm talking from health perspective. Then our nutrition team they were doing their own job. Education, reopening of schools, and also provision of education to their own doorstep steps. So child protection, water, sanitation, all of us were putting our efforts into it, that we make the lives a bit better in this crisis situation. I'll stop here.
Thank you so much, Fatima. I mean, you certainly have emphasized for us and illustrated the importance of partnerships, which is sort of really our theme, you know, in terms of this discussion, and that we will rely on those partnerships to serve the critical needs that in many ways have increased and as a result of the pandemic, not just the effects of COVID itself, but as you're talking about all of the other implications. And so we appreciate the information you've provided. So we'll actually now talk to Michael about pivoting. We talked to our partners last year about the need to quickly pivot to remote services, and would love to hear a little bit from you in terms of how the floating hospital, given its nature of serving the most vulnerable populations, was able to pivot to telehealth and sort of really having to do that so quickly, et cetera. Could you tell us more about that?
So our leadership looked into different video platforms. I think the first one we tried, a lot of our population, you know, has limited maybe technological experience. So we really had to choose the simplest platform. And so they found that, and the pivot took place quite quickly. We didn't even lose any appointments. And behavioral health lends itself to telehealth very well. Obviously you don't have to do a physical exam. So, and we ended up having 15,500 behavioral health patient encounters in 2020, which ended up being 3,000 more than the year prior. So I think we ended up seeing that, even though there was a crisis and we lost the face-to-face, we gained opportunity of higher show rates because we lost some logistical barriers of people having to find their way to the clinics.
Yeah, and with that increase, I mean, that's incredible, right? Because it speaks to the need to serve behavioral health in this kind of context that we found ourselves in overnight, basically. How did the staff deal with sort of the related, all the other crises that are sort of surrounding the big crisis, right? In terms of shortage of therapies, wait lists at the clinics, other grief, trauma themselves, dealing with health issues, just sort of the unfortunate perfect storm. Can you talk a little bit about how your hospital dealt with that?
Sure. So we obviously, we're in the providers ourselves. We're in the midst of the pandemic, and it's actually personally affected the lives of some staff members as well. And so we're also dealing with all the sequelae of the pandemic. And I think what's very key is our regular communication. We meet very regularly and at length. It's a 2-hour session weekly, which you don't really hear about, clinics doing that kind of thing, but it's very key to maintaining our own well-being, to not go at it alone. Another real barrier that came up during this time for a lot of medical clinics was finances, because the medical side was shut down. And so, some medical clinics were going in the red deeply, but that's where, our partnerships with UNFCU really just keep us afloat. And so thank you for that.
No, of course, we appreciate that. I think, and before we turn back to Fatima, one of the things I wanted to ask is about how the hospital and staff were able to help women acknowledge that their health care remains important amidst all of their other juggling responsibilities, right? So you have people who are dealing with having to use, as you mentioned, technology that are not used to that. They have children remote learning. They have, Fatima mentioned that women don't live in silos, right? So our health is one thing, our education, economic empowerment, et cetera, et cetera. How do you remind people that it's important amidst all of this to take care of your health?
That's a great point. I think that's where the therapeutic alliance and the trust and the empathy all play a role, where the person has to understand and feel that, hey, this person's not just trying to waste my time or just going through the motions. They want to see me advance. They want to see my life improve. And this investment I'm making on my end is going to help with those goals. We look at each person where they are and come up with appropriate goals and interventions to meet them where they're at.
That sounds like a really holistic approach, and we appreciate that. Thank you so much. And so we'll turn back to Fatima. Fatima, we're wondering, given the sort of the time that we're living in terms of pressing and growing humanitarian needs worldwide, how does the team prioritize healthcare access? So, we're really looking at when you're dealing with all kinds of inequalities on the ground that it's not necessarily that healthcare doesn't exist. It's really how does one make sure that women and girls are accessing quality healthcare, and that the inequalities that we experience in so many other ways are not also replicated in that access to healthcare. So can you talk to us a little bit about how UNICEF has sort of helped people to be able to do in local communities, right, the most vulnerable, be able to access that?
Thank you so much. It's again a very important question. And I remember when in the very beginning of COVID, or most countries were in lockdown. It was a nationwide lockdown, and our worries were that how people would access to, how would they have access to care just, I'm not talking of quality right now. I mean, would they be able to reach to health facilities? And also if they are able to reach to facilities, would these services be available? Because in many countries, they redirected services. And in some countries, they moved midwives, competent midwives from that facility to a COVID designated site. So we were hearing those things, and we do have at regional level, some WhatsApp group with our multi-country colleagues, especially the providers. And they were talking in the WhatsApp groups, and also we were going through newspapers to see if there is any news and things like that where we could make a strong case about it and something like that for our advocacy as well. And even under that case management group, some of our colleagues were really literally keeping an eye on social media, keeping an eye on newspaper, keeping an eye on country, whatever colleagues were sending messages and all for the disruption of services. So it was a very active and deliberate effort to identify if our women and children are facing those difficulties. And unfortunately, very unfortunately, we got news a few days apart from two of our countries where a woman died. It was in newspaper also, one in Kenya, one in Uganda. And that was basically because they could not reach to the facility because of curfew hours. And the thing is, when countries make rules and regulation, at times it's a blanket kind of thing, and for people who are working on essential services, they need that special instruction. Okay, there's a pregnant woman or a child in need or a sick person, must be given permission to move ahead. And as soon as these information, we brought them in the notice of those ministries, and they were very quick, I must say. I must appreciate and their efforts, that they were so quick to come up with those specific guidelines. And since then countries started, ensuring that all women and kids and adolescents, whoever is there, if they need services at any point in time, even if it is a curfew time, they're allowed to go. So that was our advocacy efforts. It was, again, I must say, it was a team effort, a very trusted partnership effort, which we all did together, and that's how we ensure that that services should continue. And the other thing as UNICEF, what we did was is the ensuring infection prevention practices are in place in the health facilities, because one of the points where our providers and also our clients were fearful of coming to facilities, because they knew what is the situation pre-COVID. Right. And they knew that if I go back and if it's still the same water and sanitation situation, I may acquire COVID from the facility. So that's why, because of fear, also many people were not coming. And also there was our own healthcare providers were also at risk of getting infection, and they're the backbones of the system. So we invested on the infection prevention and water and sanitation efforts. We also invested on the provision of personal protective equipment. So it was, again, from all angles, from preparedness to response, we ensured that services must continue. And of course, there were things which were beyond our control because of the global shortage or global supply chain restrictions and all those things. But countries, I must say, they tried their best.
That's really
our governments and our partners, everyone.
right. Thank you so much. And it sounds, you know, what you're describing sounds like not only the urgency of continuing the essential health services, but the urgency of information sharing and making
Exactly.
information sharing continued. You know, one of the things, and just to stay with you a little bit, one of the things that we heard so much last year was about the resiliency of not only, of course, the partners that we're working with, but the women and girls that they're serving, and men as well. And so wondered if you heard things or learned things that surprised you in any way, things that sort of reminded you of resiliency in the work that you were doing last year and even this year.
I mean, this was from 2020 until now. We feel like it's an extension of 2020. We are not really in the new year because we are still in the same phase. And with COVAX and everything, it's a new struggle with now what we are taking on. I would say every moment was a kind of a feeling where you would say, we could have, before COVID, we couldn't have think about it. And now we are doing it. And I think partnership in itself was one of the things where, and we did a lot together as partners, or we did more than what we could have even imagined. So I would say, COVID impacted everyone, even in the developed world or rich world. It showed it was, the gaps were quite evident in that part of the world also, which we call a rich world or developed world. And seeing even that was also a surprise to us, that we are facing the struggle which we are having in this part of the world. Rich part of the world is also facing the same challenges. So that was one thing. But resilient, I would still say that at times we underestimate our systems. But still, it was an eye-opening fact that our systems have resilience, and also the togetherness of even the spirit of supporting each other was also even at individual level. I would not be able to, since I don't work in countries, I may not be able to give you a specific scenario, but to me, every moment was a moment where you feel like, which you could not have imagined pre-COVID. Yeah.
No, I definitely understand that. And as you mentioned it, you think about that there's nothing like a crisis to show the gaps in the system, but also the innovation, right? And so to thrust us into innovation.
Yeah. Thank you. Let me just give you an example of innovation where we remind me that. But innovation, we could not have imagined that women would be provided ANC services via WhatsApp groups, or or we go for telementoring in the facilities. This was happening. Some services in mental health were like that. There was telemedicine, which we heard during this time happening, which one could not have imagined. We also, there were also virtual trainings, which was not a possibility. And then also group therapies and all those things virtually doing for healthcare providers and all. I think these all were innovation which we could not have imagined before COVID. And now we are leveraging on it.
Thank you so much. Thank you so much, Fatima. Appreciate that. And I wanted to remind the audience, feel free to put questions in the Q&A. We will get to them soon. Maria Rosa, we'll turn to you. You talked about in the introduction sort of the power of partnerships, and we know that UNFPA obviously really relies on the power of partnerships. And I'm wondering if you can join me. The pandemic really highlighted, we've been talking, each of us, about the need for collaboration, the need to be able to serve people on the front lines, et cetera. Wanted to know if you can talk a little bit more about sort of how that power of partnership and active collaboration will influence the way that UNFPA does its work from now on, right? So it's always been that way, but how might that even increase and impact the way that you work moving forward, the need for that?
Thank you, Ima, for that question. There are so many things I'd like to say, but let me put on the table maybe 3 starting points. So last year, it was also the 75th anniversary of the United Nations. And one of the key points in the discourse was multilateralism. So one of the things that we thought about last year during the COVID-19 was, how do we want this multilateralism to work in order to achieve the Sustainable Development Goals? Well, what the first lesson that we learned was business cannot be as usual. So we spoke for many years of involving the private sector. I come from the private sector. On the other side, I have partnerships with the UN. So, I mean, we spoke about that for many years. But it really last year, what was different was the way we tried, let me say, to align languages. As you know very well, building a partnership at all levels is a matter of aligning languages. We speak many times different languages, and many times we take a very long time to align those languages in a partnership. Well, last year, we were very quick. Last year, we came together real quick to address the emergency, to somehow ensure the continuity of services. So we did things, I can very well say, in a very different way. As Fatima was saying, things that before seemed not impossible, but like really difficult to achieve, became immediately possible. So, and Michael might say more on that, but the human mind can really surprise you, and it can take you to unpredictable results. So that happened with partnerships. And they were not only partnerships around mobilizing resources. We don't hide behind a finger. We rely on the role of the private sector. We rely on the role of philanthropy, somehow come together with us for resources. But it was not only that. It was also building visibility. It was also building strong innovation that, and let me underline this point, because I think this is one of the keys, that leaves no one behind. That is one of the key points we don't have to forget. We very often speak about leaving no one behind. Well, the pandemic last year and continuously now is showing us that whether we do something really concrete to address the most vulnerable groups, to address inequalities, to address whoever is left behind, or we're not going to have not only sustainable partnerships, but a sustainable world. We're not going to achieve the Sustainable Development Goals if we don't put the leaving no one behind in practice. So we learn to be more quick. We learn to work together much better. As you know, I mean, the UN is a bureaucracy, the private sector is a different speed. So we align speeds, and that was really important. And again, we sent a strong message that, you know, you build resilience also through partnerships. You can make an impact, you can measure the impact, and you can do it in a very effective way and with a shorter time. And these are lessons that we really don't want to forget, and that are part and parcel of what UNFPA is doing now. As you know, we're building our new strategic plan. It's our corporate document for the next 5 years. Well, partnerships need to be a certain type of partnership to achieve our results.
Right.
So they really need to be built based on these lessons.
Now that's critical. What you've described is really, really critical. It sounds as if we will learn so much more about being effective in those partnerships going forward. We have to. And I appreciate the urgency of what you've described. Thank you so much. So we have time for a couple more questions before we turn to Q&A. Michael, I'll turn to you. I wanted to talk a little bit about, as we look ahead, particularly, and we've talked about the importance of mental health services and support. Just thinking a little bit about, what do you think has to happen in terms of some employment readiness, given sort of the mental health almost crises that people have been through, the burdens of being a part of a pandemic, you know, and on top of all of the other things, violence and other things that have sort of been exacerbated this past year. Can you talk a little bit about the things that the Floating Hospital is doing to support women to be able to go back into work and employment readiness?
Yeah, so there's a lot of different layers. so to be employable, you have to have obviously a level of functionality. So if there are symptoms that are making things, you know, where you just can't be somewhere at a certain time, or interact with people in a way to do tasks in a reasonable manner, you know, then we have to work on those basic things first. Then you work on deeper issues, which are sometimes barriers, self-esteem, self-worth. You know, these are common issues you hit in therapy. Sometimes you get down to the real practical nitty-gritty of, let's say, just the anxiety that an interview may engender, and you role play that out. So there are different levels. You work on communication skills is key. A lot of times that ends up being the limitation of someone in a workplace interpersonally, that it's just not happening. And we often work on those types of things in therapy as well, in behavioral health.
That's really great. Thank you so much. And so I wanted to just ask all of the panelists actually to join me on camera, and we're going to do a quick little go around before we go into the sort of Q&A session. Wondering if all of you can just leave us with one sort of parting thought before we go into the Q&A session of what your organizations see as most critical for moving ahead in this next year around women's empowerment connected to the SDGs, the Sustainable Development Goals. If you can just name sort of one thing. And Michael, I'll start with you since you're still on screen.
Self-actualization, just, you know, becoming that person you're meant to be.
That's great. Thank you. Maria Rosa?
Well, I might sound boring, but I think really partnerships at all levels. I would say ecosystems, as I said at the beginning, where different stakeholders come together to really support our work.
That's great. Thank you. Fatima?
I would say let's reimagine, or let's build back better as our services for our women and children.
Thank you so much. We're not quite ending yet, but I really want to just say thank you at this juncture to all of you for sharing both the challenges as well as, I heard opportunities, I heard innovation, I heard resilience, I heard themes in terms of the ways that this crisis has changed the way that we work with our communities, but also the opportunities that we have to help people. And of course, at the end of the day, the resilience of the women and girls to whom we serve. And so that's really critical. You know, I think that we at the UNFCU Foundation we continue to be really proud of the partnerships that we have with all of you. And so I really want to thank you. I will thank you again before we end. But before we do that, I want to ask Liz Philippe to help us through the Q&A session. Thank you, Liz.
Thanks very much, Eva. Hello, everyone. Yeah, we have some interesting questions that have come in. I'll start with the first. How can organizations partner with UNICEF, UNFPA, or UNFCU Foundation to provide services in the field? So another key question about the power of partnerships. So I open that up to anyone to respond to.
Great. So anyone on our panel can answer.
And jump in.
So for us, as for UNICEF, the core criteria for partnership includes respect to UN standards, including human rights, transparency, integrity, capacity to carry out partnership, and the potential for achieving strategic results for children and women.
Maria Rosa?
Yeah, so thank you. And adding to what Fatima already said in terms of let's say, general requirements, I think really the word strategic is important. So the fact that the partner somehow is beneficial to achieving our 3 transformative results, and there is a win-win situation. And another important thing that we see very recurring for successful partnerships is really the clarity on roles and responsibilities. Every partner is precious. Every partner brings an added value. And we think that complementarity is really, really important and key for partnerships. But of course, maybe for that question, there are very different ways to partner. So once is, as I said, for visibility, innovation, resource mobilization. And in the field, basically what we have, our program countries basically replicate what we have at the global level. So there are really different ways for different types of partners.
Very good. And question for Michael: is the floating hospital only in the United States? Describe the scope of your work. And do you only focus on mental health?
It's only in New York City. So it's maybe, I would say, a small to medium health clinic that provides primary care, dental, and there are a couple specialists in there, and pretty robust behavioral health services. But it provides a surprisingly broad reach. So before the pandemic, we have our own vans, and they would go out to about 27 of the different homeless shelters within the city to bring clients back for services.
Terrific, thank you. A couple of questions here about criteria and requirements. How to get involved? How can we support you in terms of developing the partnerships? So just a little bit more detail on the requirements and again how to jump in from anyone.
I can start, and maybe Fatima, if you want to come on board on this.
Sure.
One of the things is, well, depends on where the request of the application comes from. But usually our partners go through a due diligence process. So there are criteria that are around respect of human rights, respect of the environment, of labor rights, and another set of criteria that are really important to partner with us. They are on our website, so actually they are public. And again, what is very important for us is to start conversations around a shared goal. Not every partnership is good for everything, and not every partner is good for everything. So there can be different types of discussions according to the type of partner and partnerships. Usually a strategic, let me make a distinction, which is very important. Usually a strategic partner is different from an implementing partner. I guess some of these questions have to do also with implementing partners, that are partners that work with us and somehow deliver services in the field on our behalf and working with us. So there are different ways to consider those partnerships. And there are different criteria that we can share.
Very good.
Great. So Liz, should we wrap up? Do we have one more question, or can we wrap up now?
Yeah, we could wrap up maybe just with one last question about, are you hopeful about the future? Has women's empowerment come a long way since Beijing? Does anyone want to provide their honest feelings about hopefulness?
I often tell clients or patients, I wouldn't be in this business if I didn't have hope for you, for humanity, for the future. So yes, very hopeful.
I'm also very hopeful. We have seen a lot of progress. It's not like that we have not been able to make any dent or move the needle. There has been significant progress, but there's a long way to go, and we must remain hopeful. That would be a fuel for us to do more.
I can just add that my father used to say that hope is the last to die. And not only we remain hopeful, but also we remain passionate, persistent, and committed.
Terrific, great comments by everyone to end on. Ima, back over to you.
Thank you so much. Thank you so much, Liz. And thank you so much to our panelists. I really, really appreciate that. That's an amazing note to end on, I must say, for us. We are thankful to all of you for joining us. You know, we've learned today that there's been innovation, there's been really resilience in terms of the ways that we've been working together. We talked about telehealth services for mental support. And we've talked about wonderful pivots in terms of the services that we are providing to the clients that really rely on us to do so. So I just want to say thank you so much to our panelists. It was really incredible for you to bring not only the work and the challenges alive for us in terms of describing that, but also really the stories of the beneficiaries that really rely on those services, the videos and the comments that you made. We really do appreciate that. Just a note before we end about the UNFCU Foundation. We are, as Pam mentioned, an independent nonprofit organization based in New York, but serving folks, supporting organizations globally. The foundation itself is an extension of UNFCU's service mission, and it aligns with the UN Sustainable Development Goals. And really, since 2015, in collaboration with our amazing project partners on the ground, our foundation has helped more than 37,000 women and youth lift themselves from poverty. And we're proud that this year we were able to acquire our Better Business Bureau accreditation, and are excited to be able to continue to support the important work like what you've heard of today and other work. Really for us, like everyone else has talked about, the power of partnerships is also central to who we are as a funder and as a foundation. And we will continue to fund that and to fund the resiliency of women and girls around the world. So we look forward to keeping you informed about UNFCU Foundation and about our work. We invite you to check out our website, unfcufoundation.org. We have wonderful social media that we'd love for you to follow and to join us and to stay in touch. And we're excited about the work that we have ahead, as many of our partners have described. And we know that, as the old African proverb says, if you want to go fast, go alone. If you want to go far, go together. We really look forward to partnering and staying in touch with you. So on behalf of our board and management and volunteers, we do want to say thank you so much. Again, thank you to our amazing grant partners that were on the panel today and those that weren't able to join us on the panel today. We thank all of our grant partners for the work that they do. I do want to say thank you to Pam McNone, our board chair, to our marketing team at UNFCU, and in particular Liz Philippe for organizing this panel, and Awu Ali for supporting us, as well as to my colleague Saeed and to Yvette Duran, who work on our foundation team. And thank you, everyone. Stay safe and be well. Thank you.
Thank you.